Hello, everybody. Nice to see you all. I'm just going to give everyone a minute or two just to connect and join, and then we will get straight on with it. So you are very welcome to have your cameras on or cameras off. Do feel free to say who you are in the chat, and as we go through, do feel free to put questions in there. So we'll just give it, there's still people joining, which is fab.
I just joined the, who was it?
And we will ask you to mute yourselves as you come in, if that's all right. And I'm sure Olivia or Sonia will go down the list of participants and mute people as they go. Right, Katie's come in now as well, by the way, so that's great. So I'm just waiting for one more person. That's it, they're in. Brilliant. Just a flow of people coming in. So Olivia and Sonia, if you can keep admitting people, that would be fab, if that's all right. Okay, let's make a start. I think Katie Knight is with us. If you are, do put your camera on, Katie. That would be brilliant.
Hi there. I'm not sure if you can see me.
Yes, hi Katie, brilliant. Right, okay, let's make a start. So welcome everyone to our seminar series for the International Evidence Collaborative. If I could ask you to mute yourselves and then any chat in the background doesn't disturb us, that's absolutely fabulous. So today we're going to talk about children and young people, and we've got a bit of a research journey to tell you about, which will be great. But first of all, it's a welcome back to the seminar series after a short break of a couple of months. The aim of this seminar series are really to help you to disseminate your research that you've been doing, to find out what is happening, make connections with other people that are researching, evaluating, that are part of social prescribing, and really just keep us collaborating as a community of practice. And there might be times that you want to be able to disseminate some of your research, or you want to get a survey out there or things like that. So do contact us at Evidence Collaborative on, and let us help you disseminate stuff. Before we talk about children and young people, we have some people to introduce to you. So there has been a new research team come in at NASP, as well as a new CEO. So hand over to Anthea, who is now head of evidence at NASP, head of evidence, head of research, head of evidence, I think. So Anthea, over to you.
Hi, we've got a very packed agenda, so I won't take up very much time. Just to say it's lovely to virtually meet you all. I'm Anthea Terry. I'm the new head of evidence and evaluation, and in the team we also have a senior evidence specialist, which is Olivia Engel, who will wave at you, and Katie Knight, who is a senior evaluation specialist, and we really look forward to working with you more in the future.
Thank you very much, Anthea. And so welcome to you, welcome to Olivia, welcome to Katie. And there are also three coordinators that will be joining us, and hopefully we'll introduce them at the next seminar that we do. So the programme for the seminars through to November now will be published shortly, so that you can keep signing up, and it will be like the third Wednesday of the month or something like that, so lunchtime. So hopefully you can keep joining us. Right, so I'm going to start this one off and want to tell you how we started developing children and young people's toolkit, and it's been quite a lot of research that's gone on. So let me just share my screen. Here we go. Now let me get it into presentation view. So hopefully slides, there we go. So I'm just going to get rid of speakers. Brilliant. So this is really about developing a children and young people's toolkit for social prescribing, stage 1. So we were commissioned, so Street Games were commissioned, and Street Games put a team of people together And the idea was really to look at what is good practice for children, young people social prescribing. How does that differ to adult social prescribing schemes? Who needs to be involved? What else do we need to think about? And can we then support this to grow? And this came out of Street Games setting up the social prescribing sort of young people social prescribing network. And they had a conference at University of Westminster when I was working there, and I hosted that. And we had James Sanderson, head of personalised care, come and actually say, oh, we need link workers for children and young people. And then things started to move from there. So the approach we took, and I'll tell you who the team is at the end, but the approach we took was all about collaboration to understand lots of different stakeholders' perspectives on what would be good practice. So we did quite a few different things, and different people in the team went off and did different aspects of this work. So we had an online consultation that had draft principles in it. So there'd been quite a bit of work to begin with to put draft principles together. And I'll tell you more about that in a minute. There were interviews with young people and people voices, young people that had used social prescribing that could tell us about their experience and what they valued, and from parents that could tell us about some of the challenges. You know, if you're a parent with a child with additional needs and struggling for them to get to school and support they need. There was a review of caseloads done with other professions to look at what might be an equivalent caseload.
And then I'm like, oh, okay, you know.
Can we mute, please? Thank you. So the review of caseloads is really to understand what equivalent professionals would have as a caseload, which we think is really important, and focus groups as well, which are led by Family Action. And this was commissioned by NHS England. So what we ended up with is a whole site of resources on Street Games website. And when you get the slides, this is a live link, but I'm sure someone might find the Social Prescribing Youth Network link and pop it in the chat if you want to go straight there. And there's all of these documents which you can download. So you literally scroll down the page and there's all of these different documents. So there's the principles document, there's one on outcomes, there's one on safeguarding, there's an executive summary, the caseload briefing, and some case studies of work that was underway at the time. So just wanted to tell you a little bit, just give you an idea of the scope of the online consultation. So this actually happened 26th of March 2020 to the 17th of April 2020. So that is right at the beginning of lockdown. But despite the turmoil, 674 people clicked in and started the survey, and we had about 447 people go all the way through to the end. So there were a couple of aims. One was to understand what's the state of play of social prescribing for children and young people at that point in time. Like, is anybody really doing it? How many people? What can we discern? And then the second thing was to get all these different stakeholders to give their opinion on these principal statements that would make up kind of a guidance statement document to say, what do we think is important for the design, the implementation, the running and evaluation of social prescribing for children and young people. So the comms on this was very targeted to these different stakeholders to really capture different voices. We worked really hard on that until lockdown craziness got too much, and we thought it's probably people just don't need bothering from us. The main thrust of the survey was for people to tick boxes rather than write lots of qualitative data, but we really wanted to know what was essential, what was the desirable. But also what we needed to think about, well, who are the stakeholders for children and young people's social prescribing, because they do vary from adults. And there's the thing that's different is services wrap around a young person, a child and their family, whereas with an adult, you go off to one service and then you go back to the GP, and maybe you go out to another one, or you go to a consultant and you come back to GP. And as an adult, you try and navigate that yourself, which we know is difficult, which is why social prescribing is so helpful. But actually this is wrapping around, and we thought about what is universal, service, what is targeted provision and early intervention, what is statutory intervention and treatment, who's involved in all of that, so who are all of these stakeholders that we want to talk with. And there's others there as well, but we're looking at how is the current system set up, and that's a bit of work that Marcello Bottotti kindly did with us. So who responded to the survey? So we got a really broad response. So just to give you an idea, we got good responses from the VCSE, NHS, local authority. We had clinical commissioning groups, education, and different levels of education as well. And the blue bars are everyone that started the survey, and the orange bars are those that got all the way through to the end. So there was a rough mirror of that, so it's pretty representative of the data. We also had responses from across every region in England, and we had responses to understand where are people at with their social prescribing scheme. Are they up and running, or early discussions, maybe planned and funding's confirmed? You know, we just wanted to know. So basically, not a lot of people were doing it. A lot of people were not even considering it, some people thinking about it, and a few were up and running. So the key thing that we wanted to talk about were the 8 principal themes that we tested. These were different aspects after talking with various stakeholders to begin with, and a lot of roundtable discussion, building on what we know about social prescribing for adults as well. There were 8 principles that we wanted to explore with people. And you can see them written here, so I'm not going to read through them. But what the survey did was take one principle, say governance and accountability, and then there were a series of statements for people to rate as essential or desirable. So this wasn't all of them, there were about 7 or 8 for each one. And then we tallied up where people thought things were desirable or essential, and that really helped us understand what to include in the final resource. There was a little bit of room for qualitative comments, but mainly it was a forcing people to tell us their opinion. What we end up with on the Street Games website now is a lovely document that takes all of our data, and it's designed nicely and it's downloadable, and you can use this document. And actually there are now 7 principles, and then we've got the key points in there as well. So that's been there for a while, and it is really useful, particularly if you're starting thinking about children and young people's social prescribing. Just helps you think, what do I need to think about? What do I need to consider? When do we need to consider it? You know, and if you've got a scheme running, you can use this to say, well, where have we got to, and what else could we be doing to improve the scheme? We did ask people, you know, what outcomes do you think should be measured for social prescribing schemes for children and young people? And people that know me know that I like to talk about outcomes. But it's really important to think, how do we evidence the full breadth of impact? And there were 190 suggestions from 82 people. And these range from the right-hand side here, you can see skills and employment, because young people goes up to 25. So you've got the move from education through further education or higher education, and employment and things like that. Economics, resilience, communication, obviously lots around well-being, number of connections and things like that. So really great to get that sense of what people think is important. There were focus groups and interviews I carried out, and there's just some themes that I just wanted to share from young people. So these people that had used social prescribing, and they were talking about why it was useful or what they wanted from it. And one of the things that very much came across was about enabling a young person to become more confident and independent. And of course, those two go hand in hand. And some of the ways of helping a person do that was that the social prescribing link worker would accompany them to activities or first meetings, and having that trusted adult there that they'd started to build a rapport with gave them the courage to sort of move forwards. But also, I think really important, demystifying how to navigate situations. So an example is like somebody that's really low confidence, anxiety, just getting on a bus, like never got on a bus before, haven't been shown how to do it. That basic mentoring and just going, right, so when you get on, you do this, you say this, you tap your card here, you do that, and just having some support to do some of that. And of course, if you can't use public transport, a lot of people couldn't get to the activities that they were being prescribed anyway in the community. So some really interesting findings. Having a link worker liaise with a range of people, particularly CAMS, parents, other organisations, was felt really valuable. And again, something that I think is a little bit different to adult schemes is where young people are saying, actually, we want some on-the-spot situations and solutions and coping strategies. So often they get in a situation really anxious. They want to be able to kind of text the link work and go, oh, you know, this is happening, what do I do? And get a message back that goes, right, remember your breathing, you know, look at 5 different things, touch 4 different things, you know, that kind of the coping strategies. So that is really the expectation of the speed of response, I think, is very different with children and young people when they're with the link worker. And also the messaging could be through text or WhatsApp or whatever secure platform is there and appropriate, as opposed to a phone call or a face-to-face meeting. But a lot of young people would like face-to-face meetings, but have that extra flexibility. And I know that Dan and the researchers asked people, what, you know, how many sessions do you think it would take before you really were able to tell a link worker what's going on? And they said a minimum of 2, but more like 4 before they really had developed that sense of trust and the link worker has shown themselves to be dependable. So I think that does make us think differently about how do you design to really support with that young person. So we have additional recommendations from all of the work. So I've gone very quickly through and just picked out things that I thought were really pertinent. But these additional recommendations were include the voice of children and young people. And actually in the principles document, in every principle, there'll be something about involving children and young people. Even here further down, it's, you know, getting them to co-produce the promotional material. And then we know that it's being promoted and it's designed in a way that children and young people are comfortable with. There was really interesting discussion about, do you have a youth specialist link worker or an all-age link worker? And that married in a little bit with what's the difference between a youth worker and a link worker with people. So there was some, you know, felt like there was further work to go with there. I think the link worker is, it was really divided opinions. And I think this will sort of maybe work differently for different schemes. I've just finished evaluating the Battersea Youth Clinic, and they started off with a youth specialist or a link worker for young people. And then they find there were times in the day where the link worker wasn't so busy because a lot of the people were in school or different types of education. So in that time, they could be doing adult social prescribing work. So they actually moved it to an all-age model, but also were very aware that if people were working with adults, they needed to know when they came into the job as a link worker that they were going to work with young people as well, because not everybody does want to work with children and young people. So there's ways to do it and there's ways to think about it. And there's so that's really interesting. But I think maybe Helen says if you drop a link to that report, people can have a look at that in the chat if they want to. Yeah, engaging with additional stakeholders, it's really about thinking who else do you need to engage with that you wouldn't for an adult service. And I think that's really important. And thinking about how NHS mental health support is now being put into education sectors with trailblazer programs and things like that. So getting a handle on what's happening in the local area. I think the last one at the bottom there is understanding social prescribing and youth mental health provision. And I think this is incredibly pertinent as we've come out of the pandemic and we've seen horrendous increases in mental health issues for children and young people. So how does social prescribing work alongside CAMS and alongside other provisions that are going on? And that was really flagged as an area to look into more. So I'm just going to finish here by saying thank you to everybody that was involved. And you can see that within the Social Prescribing Youth Network or Street Games sort of team, there was Marcello from University of East London, Paul and Dawn were from Street Games. Dan, who's now mainly at UCL, but I think was at Aberfoyle. He can correct me in a minute because he's going to speak next. We worked with Lisa, who you'll hear from in a minute, who was at NHS England. And then there's the PenArc team, Kerry, Vashti, Kate, and Siobhan, all the survey respondents, the interviewees, and Family Action that supported getting the focus groups going as well. So it was a big collaboration, and I think it produced some really good findings. I'm going to stop sharing at this point, and I want to bring in Dan Hayes. So Dan, you're at UCL now.
Correct.
Feel free to give yourself a little bit of an introduction, because then you'll get it perfectly accurate. So I'm handing over to you.
Hey, I am Dan Hayes. I'm a Senior Research Fellow based at University College London and a little bit at the Anna Freud Centre, National Centre for Children and Families still. My background is mainly in person-centred care with children and young people, with an emphasis on social prescribing and community assets. Just share my screen.
And Dan has been working on children and young people's social prescribing for quite a few years with different projects, haven't you, Dan?
Yep. Can you see the full screen okay?
Yeah, that's great, thanks.
Perfect. So introduce myself. So today I am just going to give a brief overview of the growing evidence base for children and young people social prescribing. I'll be drawing on 3 pieces of evidence to do this, 2 NASP commission projects, one of which was a rapid review to explore the evidence base in relation to mental health and well-being. The other is a snapshot, which kind of outlines the current landscape of social prescribing for children and young people. And then briefly finishing it off with some qualitative findings from a study which was looking at factors affecting implementation with an emphasis on those perspectives from the front line, such as link workers. Marie did it at the end. It's very similar to the people that have just been mentioned. So Karen, Marie, Marcello, Paul, Dawn, as well as Jo Keown, Emily Stapley and Annabelle Olsen have all been instrumental in putting these 3 pieces of work together. So thanks to them. So I'll just start with the NASP rapid review. The question that we wanted to understand was the evidence base for social prescribing when it comes to children and young people, with an emphasis on mental health and well-being. And this was following a review which we tried to conduct 2 years earlier in 2019-2020, where we found no published literature on and the impact of social prescribing on children's mental health and well-being. So the idea was to run it again with an updated search and hopefully get some results. We chose a rapid review methodology, as the idea is it kind of synthesizes findings quickly, but using the rigor of a systematic review, which then allows us to kind of make recommendations and next steps, which can be translated into policy and practice more quickly. And we looked at a range of mental health and well-being outcomes, such as depression, loneliness, quality of life, and searched the academic databases outlined on this slide. So in terms of findings, we screened a total of 587 records, and 4 studies, I'm pleased to say, met inclusion criteria based off of an increase of 4 from the last review. One was a pilot evaluation across 3 sites in England, and the other 3 included studies were evaluations of specific mental health social prescribing schemes for children and young people, again in England. Age ranges were from 11 to 25, but the mean age of those entering the services was 15. And given the diversity of outcomes, the referral reasons were all related to different aspects of mental health and well-being, ranging from quite general mental health difficulties through to specific populations, such as vulnerable young mothers. Synthesizing the results, 4 of the studies looked at mental health and well-being, and 3 found positive outcomes on pre-post testing. and the one that didn't had quite high levels of mental health, positive mental health and well-being at baseline, which could probably account for this. And for both mental health and well-being, as well as loneliness, which was looked at in 2 studies, those individuals who had worse difficulties at the start tended to benefit more than those who were less severe. Only one study looked at the impact of health service and economic provision, but that found positive findings, and they attributed social prescribing to lower rates of GP and A&E attendance, and suggested a favourable return on investment, so for £5 of economic benefit for every £1 spent. So to conclude, in terms of the review, there's an emerging and promising evidence base for how social prescribing can support young people's mental health and well-being. And this is particularly for older age young people where it's been studied more extensively. However, further, more robust research is needed to confirm these findings. And this will be further benefited from projects such as Choices, which are led by Kevin Husk and Bashti, as well as Wellbeing While Waiting, which is being led by Daisy Fancourt. To complement the review, we also did a snapshot survey, which was developed in NASP and collaborators. And this was to understand the current landscape and provision of CYP social prescribing and any barriers with regards to implementation. This was distributed through networks such as the Social Prescribing Network, NASP, and Youth Social Prescribing Network. And in terms of kind of key findings, there were quite a few, but I'll just kind of give you the brief kind of headlines. There were 208 individuals who completed the survey. The highest proportion was those of link workers, which were 40%, and this was followed by activity providers at 25%. More than half outlined that CYP social prescribing was available locally, and 45% of these were launched in the last year, which suggests that there's a rapid expansion of CYP social prescribing, particularly when you think about it compared with the survey that Marie showed. And a further 40% of those surveyed who did not have CYP social prescribing at present were working on implementing it. In terms of stakeholders, stakeholder responses were mainly based from VCSE, so voluntary sector and community enterprise organisations, primary care networks such as GPs or local authorities, suggesting this is where CYP social prescribing may be happening more at the moment. And there was an underrepresentation of CAMS and education. However, despite this, schools were outlined as a key place or venue for facilitating social prescribing, as well as other community hubs. Barriers, which were examined, looked at both major and minor barriers, and major barriers which came up focused around funding of services and service implementation. So this included both staffing for link workers, as well as funding for CYP activities to address health inequalities. There was also barriers around implementation, information sharing, and how to disseminate best practice amongst CYP social prescribers. And safeguarding concerns were not seen as a major barrier by those surveyed. The last piece of evidence I briefly wanted to share with you was a deeper qualitative dive into the barriers and facilitators that affected social prescribing, interviewing those who are on the front line, including link workers, service managers, and those involved in delivering activities. Now, I won't have time to go into the methodology in depth here, but we used a framework approach which looks at different domains which can affect implementation. And this included things such as skills and the environment people are in. And we identified 33 different barriers across 3 overarching constructs, which could be split into capability, opportunity, or motivation. And I'm going to talk through 3 specifically, with 3 today, which were specific to children and young people. So under capability and falling under the domain of knowledge, link workers outlined that there was often a lack of clear policies and guidance when working with social prescribing for children and young people. I should say that this is before the toolkit was developed. Link workers acknowledged that the online module for CYP Social Prescribing was good, but going beyond this didn't know whether what they were doing was good or best practice, and often spoke about having to adapt existing guidelines which existed for adults to try and meet the needs of their population, but also worried about whether this was correct and the nuances of working with this population. Under opportunity, another one that came up quite frequently was a lack of appropriate spaces to interact with young people. This was often when link workers were based in primary care networks, where the spaces were thought to be quite clinical, non-welcoming, and as a result, it was felt that young people may be less likely to engage or open up. So where possible, they tried to find other venues in the community to facilitate these types of conversations. And lastly, in terms of motivation, there was a lack of confidence when working with parents and guardians, which was often seen as a barrier. Individuals often outlined that they didn't feel confident engaging with this group, particularly when there was discordance between what parents might want and young people might want, and balancing the needs of having the parent on board, particularly when it was a rural location and the parent may be quite instrumental in getting the young person to and from a said activity. As a result of this, suggestions were made around further training to help with negotiation between these different stakeholders where possible. So just to conclude that whistle-stop tour, there are general barriers which seem to be quite specific across all of social prescribing, but there's also really specific and unique barriers when working with children and young people. And we probably should think about further training, support and guidance which are needed for link workers and those engaging with these populations to better support them, as well as flexibility for link workers to meet in different locations where young people feel comfortable. And there's some references at the end. I'll stop sharing now.
Thanks very much, Dan. That's great. Very interesting to see quite how many schemes now are either running social prescribing or in the process of getting it going. So that's heartening, even though there's still a lot of challenges and barriers. So just before we take questions, and do feel free to put questions in the chat. There's some in there at the moment, but anything else you've got in, and also in chat, just note that there's quite a lot of links to all sorts of things. So it's a really good chat for some resources. And if you've got resources, let people know. So now I just want to bring in Liza Jarvis from Street Games. So Lisa, one of the recommendations was to have a toolkit, but with a bit more to it. So perhaps you can tell us what's happened in the last year. There's a bit of a pause during COVID, and then it's got picked up again, and you're totally responsible for really making sure this has got forward and is getting out there. So could we have the news, please?
You can have the news, although the postman has just come to my door. So it's always typical, isn't it, that that's what happens?
Yeah, absolutely.
I'm just going to literally mute myself and tell the dogs to shut up. 2 seconds.
Okay. Yeah. Shut up, says Lisa. Yeah. Oh yeah. We all good?
Okay, I'm back. So my name's Liza Jarvis, as Marie said, and I actually have a split role. So I work for NHS England in the Southwest team, but I also work for Street Games as the Youth Social Prescribing Lead. And it's really, really lovely to be here today, because actually I commissioned that original piece of work that was done on developing the principles work when I worked in the national team. So it's really lovely to see this come kind of full circle. So one of the things that has come out is the development of a toolkit. And when we talk about a toolkit, it's really about giving us some of the examples, some resources, some links to things where we can kind of look at what does good look like, how do we expand some of those principles that were developed, and actually how can we help people to develop a really, really good social prescribing service for children and young people. So over the last 2 years, we've been working on this, and what's really important to say is it's a co-designed toolkit. So it was really started by children and young people social prescribing link workers and those that they were working with, to really kind of go, you know what, when we started, I wish we knew these things and I wish we had these things, and pulling that all together into a set of kind of principles and statements from which you can self-assess and then look at kind of what good looks like. So the toolkit is now pretty much ready to go. So which I want to do a little happy dance. It's got to go through some design to make it look pretty and also to be user friendly. What we want it to be is a living document, so that's iterative and can be changed and added to as this kind of field of work grows, as there's new kind of research and evidence and resources out there. So it will be hosted on the Street Games website under the Social Prescribing Youth Network. We're waiting for a few little things just to be agreed and finished off. We're hoping it will be up and ready to go before the summer holidays, but absolutely worst case scenario, it will be launched fully in September alongside some other pieces of work that are going on. So it's a really, really good piece of work. What's really interesting as well is that key partners like Marie and Susie, I think you're on here somewhere, and lots of other people who've been doing children and young people social prescribing for a long time have helped influence the toolkit. So it's a real collaborative partnership piece of work that I hope will be really helpful to actually making this come alive and helping us actually develop children and young people social prescribing in practice.
Unmute myself. Brilliant. It is exciting because I've seen it and I know it's just such a great resource, and everybody's going to be like, oh wow, it's really useful, and just being able to click on different aspects and go, where are their examples, what have other people done, let's get some ideas, you know, how can we think differently and get good practice. So fab. So we've rattled through that. Thank you, Dan. Thank you, Lisa. I just sort of, Olivia and Sonia, what questions are in the chat? So we've got, you know, we've got 15 minutes for questions and discussion. So if there aren't questions, but people might want.
Yeah, Tracy highlighted, and it's always a theme in every one of our social prescribing sessions, is about funding. She said as a not-for-profit organisation, it's vital funding is in place. So yeah, the funding is always a question for everyone.
Lisa, from NHS perspective, maybe I can come to you on that. What's your thoughts around, you know, getting the best funding or where that's at?
It's really tricky. That's a real kind of like, you know, slopey shoulders answer, isn't it? But there is funding in the primary care networks for social prescribing link workers, and actually the majority of social prescribing link workers that we have, I particularly talk about the Southwest, have been funded through those primary care networks. And I think there's a real case, particularly post-COVID and with the mental health and well-being needs that we've seen escalating for children and young people, to kind of push for that, because they can draw down money through the additional roles reimbursement scheme funding. So that's one route. I think the other thing is to really not be put off by the fact that actually that is a single route of funding, but actually there's a lot of people in the voluntary and community sector who have got funding for social prescribing link workers and deliver social prescribing, but it's not under that NHS umbrella. So I think there's other opportunities to look at kind of that VCSE sector funding for social prescribing as well. So it's really about, I think, collecting your data, collecting your evidence, particularly looking at kind of your local needs assessments, population health management data, what's going on for children and young people in the local areas, and kind of lobbying as well for kind of primary care networks to see whether they'll fund some of those roles, because there's a lot more appetite than there used to be.
Thanks, Lisa. And just to say, the work we did in Wandsworth with the Battersea Youth Clinic, actually just taking the ONS4 data, we looked at the ONS4 data for the service users and compared that to the national averages. And the ONS data for sort of their mental well-being was so far below the national average for that age group that I think that served as a real like crikey. So just something simple like that, I think, has had quite a big influence in moving conversations forward from a funding. But Tracy's got a hand up there. Hi, Tracy. Do you want to comment?
Yeah, I agree with Lisa. You know, that we are using the social prescribing approach because we deliver the social prescribing program for adults across Burnley, Pendle and Rosendale. So we redeveloped our what was our young carers into our health and wellbeing for children and families team. Oh. We have, without funding from any of the PCNs, I can't manage to convince the PCNs to fund a social prescribing link worker. I've been trying for 2 years, and it's just not happening. So what we ended up doing was, like Lisa said, we've gathered our evidence. I keep hammering at that wall. I will break it down at some point. But what we've done is get little bits of pots of funding from Children in Need, Comic Relief, that kind of thing. Yeah. And, you know, and using that evidence that we get from there and keep firing it into the PCNs to say this, but they're not going to fund it if we keep doing that. So you kind of between a rock and a hard place. So that's all I wanted to say. Thank you.
Thanks, Tracy. And it's really good to hear how you've done it. And I salute you for your perseverance, because the young people in that area will really have benefited from your perseverance to get that funding and that service in place. I think as integrated care systems boards, programs, alliances, you know, take shape, it's about getting CYP on the agenda and looking at how that can be done to support what the backlogs in CAMS, and also finding the ways that meet the needs in those areas. People, other ways that they've had funding, do put it in a chat and share, and just share your experiences. Sonia, is there another question at all?
Yeah, we had well, comments and questions. Someone said it sounds like link workers need different training or skills for working with CYP. Someone else was sort of asking where and how that training is happening and where they're also being employed.
Okay, Dan, you picked up that there were different types of training needed. Do you want to just tell us a little bit about that?
Yeah, I think it's very variable at the moment, and it's very much, other than the kind of online training, which is kind of broad social prescribing with the optional module, there isn't tons for young people at the moment. So it's really been left up to local need. What we're doing as a couple of projects is kind of trying to collate all of that information to find out what is needed. And as part of the Inspire project, or Wellbeing While Waiting, where link workers are going to be working with young people who are waiting for CAMS treatment, we're seeing kind of what types of training and support will be needed there, and if there are types of enhanced training or further modules or support that will be needed. So I don't think there's much out there at the moment, but Lisa may know otherwise. But it's definitely an ongoing process and something that we're looking into developing further.
Lisa, go for it. You've got your hands up.
Yeah, no, I was just going to come back on that. So the truth is there isn't a lot that's specific to children and young people social prescribing. There is a e-learning module that sits with the other social prescribing modules on the Health Education EFL site. It's really quite high level. That all of those are, so it can be completed in about 20 minutes, but it does kind of give an overview. But other than that, I think that we really need to look at kind of the suite of training that is needed. We talk very often about having youth work skills, but actually what does that mean in practice? Where do we have mental health first training, that first aid training that is specifically for children and young people, because that comes up a lot. So I think that's a really key thing, and we make some suggestions in the toolkit, but yeah, we definitely need to bring that piece of work together.
Yeah, thank you. I've been a volunteer youth worker for 25 years, and you know, I know that there are other dimensions of training that are required when you're interacting with children and young people, and also thinking just basically about safeguarding and understanding the safeguarding that is very relevant to young children, families. From the Battersea work we did, the Battersea Youth Clinic as well, you know, you've got opportunities to support parents that are having mental health issues, as well as their children. So you know, having a link worker that works with the child and then having a separate link worker to work with the adult. There's so much that comes out of identifying a child or a young person in need of support, because often in the family there's support needs as well. It will be good that if anyone else has got training sources that they know of it, perhaps we can collate it from the chat and we can put that information around when we send the slides around. I saw someone's just said there's an annual report from somewhere, so send the link to us so that we can send you an email out with the resources that we can bring together. So the answer is yes, there is training required, and no, it's not really available. So let's look forward to hearing who's going to put that training in place. Sonia, any other questions?
Yeah, sort of related. Susie was asking, to what extent should CYP social prescribing sit in primary care, or should it be more flexible and mobile than the adult social prescribing model?
Hi, Susie. Well, I'm sure Lisa's got a big smile on her face. I think a lot of social prescribing probably shouldn't sit in primary care, is my own personal opinion, because it can become very clinical. I think from the Battersea work, when we asked young people, where would you like to meet? They didn't mind meeting at a GP practice. And actually, the Battersea people took the view that they wanted to build a relationship with young people and have them registered with a GP, so that when they did need a GP, they had a GP. And they have some very innovative ways of getting people into GP practices without crossing gang lines and putting their life at risk of going in one area. So there was a real collaboration across the PCN. So that changed my thinking a little bit on how you move forwards with this. But Lisa, what were you thinking?
So I think the current models allow for social prescribing to sit within primary care or within the BCSE sector, and both have kind of pros and cons to the way that works. I think the one thing to remember with children and young people social prescribing is that multidisciplinary team working or multi-agency working is probably more key than ever, and actually making sure that everybody has a bit of the jigsaw and that they're taking responsibility for their elements of that jigsaw. Because quite often we've seen where social prescribing link workers are potentially holding more risk than they should be, and we need to maintain professional boundaries. So actually working much more collaboratively in partnership, and that kind of team around the child, team around the family approach is much more important, I would say, with children and young people than it is with adults. So that kind of, you need both, really.
And I think having a really good, in a sense, a triage or a protection for a link worker, that they're not just getting all and every mental health for them, because you know that's emotionally difficult, and like you say, it goes beyond what's expected of a link worker and can be really difficult. So having that thought through and that design tested. And just want to welcome Paul Jarvis Beasley, who kind of led the team at Street Games. I see you're with us now, Paul, so hi to you. You are welcome to respond to any of the questions as well. Anthea, you've got your hand up though, so really hear your thoughts.
Oh, it was just a quick so I was for 5 years I was a secondary school science teacher, so I have like a small portion of my career which was young people facing, and I was wondering, I had a couple of thoughts. I wondered whether there would be some aspects of resources for teacher training that might be relevant, and then another thought I was having was, I wonder whether, we know post-COVID, don't we, that attendance in schools has become, or non-attendance in
emotional
schools,
avoidance,
I should say,
has
becoming an increasing issue. So that just struck me as an interesting area for further study, really. And just generally the kind of point about, you know, I know from my experience as a teacher, just that the difficulty of, because teachers are so overworked and have so many demands on them, and recognizing the need for multi-agency working, but just the difficulties for teachers in terms of of making those connections, those referrals, and obviously the role of teachers in being able to sort of identify those children who could really benefit from social prescribing activities, and having the trusted relationships with those children.
Yeah.
Just a
yeah,
reflection.
really good reflection. So the first one around mental health. So there has been a Trailblazer scheme going, I think since 2018, and that's taking Department of Health money into education and providing support for teaching staff and schools to address mental health and set up schemes. So if you go on the NHS website and search Trailblazer schemes, it will show you where those schemes are and where they've been expanded. And actually in the Wandsworth Battersea Youth Clinic work we did, we talk about that because I interviewed the head teacher who chairs the local Trailblazer scheme, and he said having that support has enabled the teaching staff to be trained to respond differently, to de-escalate situations with young people. So if young people are having their behavior is not very good, usually there's something behind it. So it really taught them to think differently about de-escalating and recognizing actually there's a different conversation that needs to be had. And they actually have various professionals work part-time in the school, so they've got social workers part-time in the school to get and CAMs alongside their wellbeing staff. Workers being there part-time, and they found that actually there are opportunities. They've got adults coming in and in need of support and mental health support and all sorts, who could also be supported by social prescribing. So in terms of where it sits, you could have it in multiple places. It's about where are you best going to pick up the people that need support, I think. So that mental health stuff there is stuff out there, and again there's something that's gone in the chat I saw flash up. The emotional school avoidance, I think, you know, is a target group of people that would be good to investigate how they're being supported. Dan, any of the people that are on the CAMS waiting list for the Inspire project, are those people, do you know why they're on the waiting list? Or any of them got the emotional school avoidance?
I'll be able to tell you that in a few months' time. We've literally just started recruitment.
Go on, sorry, I interrupted you.
Oh no, I'll be able to tell you that in a few months' time. We've spent about 8 months developing the pathways, and now we're just starting recruitment onto them. So we'll be capturing that as the project progresses. So
it'd be interesting, and I know there's a lot of people on the call today that are doing some of this work. So again, do share who the cohorts of young people are that you're working with. 6 minutes left. So are there any other questions, Sonia?
The last one was asking, can we get the final draft of the document that is going to be published with street games? There's a high demand now to have sight of this. I think there has been for a while.
Okay, so we'll just pause that for a sec. Paul, you've got your hand up, so really keen to hear from you because you did lead the work at Street Games that I presented at the beginning. So
yes, and sorry to be late to the party. Thanks, Marie, and it's brilliant to see so many people here. Putting up my hand might have been mistiming because it's not. I can't answer that last question.
That's all right. We're pausing that question. So.
I'm sure somebody will. But I just wanted to raise, and it may have been raised already earlier by others here, and I don't know if anybody's working in a secondary care setting, but I just wanted to reflect a recent conversation we had with a number of young patients in secondary care. I won't say where or when because of obviously data protection, etc. But some really interesting things came from that discussion. It was just the other week, and if people are working in secondary care, it was the application of social prescribing in that setting was considered by those young people to be fantastically useful. They were talking about examples of where they'd had to give up certain activities. So one was talking about swimming that she'd had to give up because of her diabetes, type 1 diabetes, causing difficulties with her legs, and she didn't have an alternative to go to. So she would have really valued some help finding alternative activities. Another one was young person was talking about how it would give them confidence before a course of treatment to know that there were connections to be made that maybe with others who were around peer support with experience the same conditions, or at least that there would be somebody they could talk to as they went into that setting. So I just wanted to briefly introduce that if it hadn't already come up, and apologies if it
No, I don't think secondary care settings have really specifically come up, but that touches on some of the sort of responses from the initial interviews and focus groups with the young people, where they wanted a trusted adult that could sort of support them, give them a little bit more courage, demystify processes, like talk them through what's going to happen, how do you do this, how do you do that.
Yeah.
And that sounds that type of thing. So
yeah, it was very much before, it was before, during and after. So
yeah,
people who felt disconnected, young people obviously get disconnected from things that are important to them,
yeah,
for all sorts of reasons, but obviously
yeah,
going into hospital is one of them. And if that's going to disconnect them from something that's important within their normal social doings, everyday doings, then to find an alternative or to be reassured that something else can take its place is, I think, quite an important process. So yeah, and there are some dedicated link workers in secondary care, not many, but
no. But thank you for that, Paul. I totally agree with you, and it's to raise the secondary care, so thank you. And before we just before Lisa answers the questions about how quickly can you see the toolkit, Nick, you've got your hand up.
Hi everyone, I'm Nick. I'm the Communications Director at NASP, and really great to see you all, and thanks very much for the presentations. I was just reflecting on the fact that Labour have committed to introducing mental health support hubs, I think they call them, for children and young people in every community as part of their kind of mental health pledge, which seems to me like a really key opportunity for social prescribing, this kind of early intervention for mental health in the community agenda. With some funding attached to it. So I just wondered if anyone had sort of given much thought to, I suppose, how social prescribing fits into that model, and what that might mean in practice as an opportunity. That's a sort of big question with 2 minutes to go, but I just wanted to kind of mention that as something that's kind of going to be on the political landscape, I guess, in the next year or so.
Thanks, Nick. And I think just for everybody and funding, keeping an eye on what Labour are starting to put out there, being able to talk to your Labour councillors, local councillors, all of that stuff, like gearing up for ready to potentially welcome a completely different government, I think is becoming more. I'm going to just hand over to Lisa. I think people can think about that local and have a look at that Labour's pledge. Lisa, you said the report, that the toolkit will be available as soon as it's available. I know people are like, can we just see a draft and this, that and the other, but I think, isn't it sort of sat with a design team and in the middle of?
Yeah, and to be fair, you know, I'm usually all about sharing and all the rest of it, but we've been through so many iterations at this point. We just want to get it out there. So we're not going to be sharing any more drafts of it. We will share the actual document when it's ready, hopefully before the summer, but like I say, if not, latest September. But yeah, if anybody wants anything, I'll pop my email in the chat, so please email me, and I've got to go, but it was lovely to be here today.
Thank you, Lisa, and we will send it out to the IEC as soon as it's available. It will go out widely. Seminar is there. You'll get the full seminar program through till November in your inbox pretty soon. So just want to say thank you to Dan, thank you to Lisa, welcome to Anthea, Katie and Olivia, and see you again next month. And thank you to everybody that's contributed in the chat with all the resources and information and questions. Thank you very much. See you again soon.